the progression of the disease as well as the progression of development kind of collide in adolescence. And so keeping in mind that it's a time when young people, their brains really are changing, and there's a lot of this in the media now, but that what we call the frontal lobe is really developing, so they tend to be maybe a little more impulsive, a little more emotional. So there are those developmental physiological changes going on along with changes in hormones. And so you have that set of issues, and then you're telling the child you have to be on an elimination diet and you can't eat what everyone else is eating. And so oftentimes adolescents will use their disease as a means to give pushback or kind of assert their independence. And it's common among other chronic illnesses as well. So keeping an eye on that, even though maybe your child becomes more symptomatic but they swear up and down they're not cheating on their diet, I would be a little suspicious of that. And then have a real respectful conversation with your adolescent and say, and empathize with it. I know this has really got to be difficult. I know you really want to do what your friends are doing. You know, what can I do to help? How can we make this easier for you? Is there anything we can do? Can we maybe forego the diet and put you on a different medication regimen and offer that to the child? Well, let's go talk to your physician and see if there's anything that we can do to make this easier for you. And again, like with your toddler, adolescents want control. So can you give that child some choices and give them some agency in terms of managing their illness and giving them the message that it is their body, they are responsible for their body. And so now you become more of a coach as opposed to telling them what to do. So it's more of a collaboration with your child, if that is possible.